monitor whether a treatment is working?
So a lot of it has to do with the CBC, so your normal blood count. And what we're looking for is improvement in hemoglobin and improvement or normalization of platelet count. And for many people, those either anemia or low platelets are the symptoms that drive people to be treated in the first place. So we're looking for those parameters to get better. With a lot of people with CLL, totally understandably, because it's the number that's the most abnormal, really focus on white blood cell count. 100% understandable. I always tell people that that's actually the part of the CBC that I care least about. And the reason is that for patients on BTK inhibitors, we expect to see the white blood count actually get higher before it gets less high. That's actually just a sign that the drug is working and it's pulling CLL cells from the lymph nodes into the bloodstream. So that's actually a good sign that it's working. And that lymphocyte count, at least in the beginning, isn't a great marker of how well the drug is working. The other thing that's important is a physical exam. So looking for whether any lymph nodes that were enlarged have normalized or gone away. And also feeling the size of the spleen, because the spleen can become enlarged to a CLL, and it's important to make sure that's normalizing as well. And then the last piece is talking to people. So making sure that if they were having fatigue or fevers or night sweats before they started treatment, to make sure that those symptoms have gone away. And that's kind of the three things that I use. I use the blood counts, the physical exam, and the interview with a patient to really understand how their disease is responding.